All right, peace be to you all. Assalamu alaikum. Omar here. I was asked about the application process to PA school, and some of you all have reached out to me on the various social media platforms, which I'm currently on Instagram, YouTube, Facebook, maybe Twitter. And you're asking me, like, what can you do to become a more competitive applicant? Yeah, at some point, you just kind of, let the chips roll where they may. I think that's the expression, because there's not a whole lot you can do at a certain point. If you have an applicant, let's say, who has a 3.5 GPA, but they worked as maybe a certified nursing assistant, they're not necessarily any better than a PA applicant who has a 3.2 GPA but worked as an ICU charge nurse for 3 years. And that's just the way it goes. The whole thing about becoming a competitive applicant is there's a quantitative aspect of it and a qualitative aspect. The quantitative aspect is really dealing with things like your GPA. There's only so high you can have a GPA. It's a 4.0. Maybe some schools can offer a 4 point beyond a 4.0 somehow. I don't know. Maybe you take extra classes or super advanced classes or something like that. Then there's the GRE. I haven't taken the GRE in more than 25 years, so I don't even know what the scoring levels are now. But let's say you get a 4.0 and perfect GRE scores, whatever those scores are. That doesn't guarantee that you're going to get into a PA program. I've seen people who were turned down for PA programs just because they didn't interview well, or maybe somebody didn't like them. I mean, I had somebody tell me that they didn't particularly care for an applicant's attitude during the interview process, so he wasn't getting into their program. That's a direct quote. And I was like, wow. So a lot of times it's very subjective, and there's as many opinions about what makes a competitive applicant as there are, people who are interviewing the applicants. I don't care if it's med school, NP school, or PA school. Everybody's got a different opinion on this. I personally, when I've been on admissions committees, I personally look for maturity. I don't really care what your GPA is to a certain point. If you've done well enough in college and undergraduate, let's say you get like a 3.0, which is the minimum that you're supposed to have to be even considered for PA school or even med school, you're not going to be statistically and quantitatively, you're not going to be considered that competitive. But you've at least gotten the minimum GPA to be considered. And then if you've gotten the minimum GRE score to be considered. Now, how do you interview? What about you would stand out to me to say that you can be somebody who could be a colleague as a physician associate, or a colleague of one of the doctors, or your patient? Do you have the type of personality and the maturity level where patients are going to trust you? A lot of times the patients only see me. They don't always see my supervising physician. So they have to have trust in me. Now, if I'm immature, if I'm rude and disrespectful, if I don't respect their opinions, or I have serious breaches in ethics or conduct as a healthcare provider, I'm going to lose credibility. Unfortunately, there's been clinicians who sexually harassed patients. They've had breaches of other violations. They've had gross incompetence for negligence. This causes the provider to lose credibility, and it affects the whole profession. So I personally look toward maturity. Somebody asked me, this particular person is completing an MBA, a Master's of Business Administration, and they were asking me if they thought that they should complete the MBA or try to get more direct patient contact hours. My opinion is, go ahead and complete the MBA. it won't necessarily make you a more competitive applicant, but you'll have another body of knowledge that will be useful as a practitioner. So there's really, some people go off and they do these post-baccalaureate programs. That's not going to necessarily make you a more competitive applicant, but really try to focus on, number one, your grades. That's the bottom line. You've got to have quantitatively, you've got to have the grades, you've got to have whatever admissions test they're using. So if that's the graduate record exam or the PCAT, the physician associate aptitude test, I think that's what it is. You've got to have at least minimal scores on those things. But then after that, if you're granted an interview, really let them see what type of mature person you are and that you've got the makings of a competent, ethically based healthcare provider. Because I don't care how well you did in undergraduate, PA school is a whole different beast. And medical school is another beast. I've had colleagues who have done medical school after doing PA school. They tell me in their own words it was night and day, so it's a whole nother level. As a distance runner myself, I run 10Ks, so it's about 6.1 miles, and I've done marathons. I've done about 20 marathons. Those are two different animals. It's like comparing apples to oranges. So, there's levels to this practice of medicine, but I would say the bottom line is really trying to be a mature person and letting people know that you have the makings of an ethical, competent clinician. I hope that helped. If you guys are interested in becoming a PA, or even if you're interested in becoming a doctor or a nurse practitioner, it's a great time to pursue those fields. We have a gray wave coming. People like me will be in their 60s in a very short time, in less than 10 years. So, we need people who are going to be interested in helping people, people with age-related illnesses. And, there's a lot going on now with gun violence and issues of mental health, changes in landmark cases. So, things like abortion and so forth. So you're really going to need people who are ethical, compassionate clinicians. That's it for now. I won't ramble on. If you have any more questions about applying to PA school, please let me know. I've been a PA for more than 20 years. I've enjoyed it. I would not have stayed in the profession this long if I did not enjoy it. It's very versatile and it's challenging, and you can make a nice living doing it. Take care. I wish you guys the best of success in your positive endeavors. Peace.